Are you looking for a way to fix your rotator cuff without having to have surgery? This video is perfect for you. My name is Dr. Molly and I'm with Your Goals Physical Therapy. I have the pleasure of helping active adults overcome their aches and pains to keep them doing their favorite activities. And in today's video, I'm going to highlight Randall. And Randall came to me when his rotator cuff was severely injured. And to the point that just letting his arm hang by his side for any length of time was killing him. He's constantly trying to find a way to hold it. He's constantly moving it and fidgeting with it. He couldn't raise his arm out to the side and absolutely forget the idea of holding something away from his body because it just was killing him. Sleeping at night at the very end started being very difficult. He couldn't find a comfortable position. And that sparked him being rather moody, short-tempered, and his wife handing him a phone number and telling him he needed to call me because she had had it with him ignoring the shoulder problem. So that is what we're going to highlight today, because he went from that place to being outside throwing baseballs with his son without having any pain at all in his right arm, which would be his throwing arm. So I just got done speaking with him after his 6-month follow-up to make sure there wasn't any loose ends that we needed to tie up, and he is doing fabulous. He hasn't had pain since he left working with me over the last 6 months, and he continues to be doing great now. So let's find out how Randall got from not being able to sleep at night to being able to throw baseballs with his 10-year-old son. A little bit about Randall. Randall is 42 years old and has a desk job. I know that's shocking. He works at a computer for very long hours. He's answering the phone, he's typing, he's communicating with people all over the country. And during the pandemic, his home became his office. And like all of us, we know that just because it went home doesn't mean you don't work really long hours. And so he was stuck in his home office for so many hours. And during the pandemic, he decided this is not healthy. I need to get some form of physical activity. So they invested in a home gym, which he became very dedicated to. He found a routine that worked for him. He got in kind of in the groove where he is very used to working out. He gets up, works out, and does his job. And then at night, he has time to hang out with his family. And this has just been his routine. So he had felt like he'd made a lot of progress in his health. He was feeling pretty proud of himself. And one day, after a particularly good workout, one of those workouts that just makes you feel like you're $1,000,000, he decided he was going to take his son, who's 10, and go outside and throw the baseball, right? So they're going to play catch, go back and forth. Well, he noticed that after a very short period of time, his right shoulder started to hurt. And he's like, it's just because of the workout. It's a little sore. I'm just going to push through this. So he did. He pushed through for a little bit longer, so they weren't out there for just a short period of time until he just absolutely couldn't. And his shoulder was killing him, so he threw in the towel, so to speak, and went inside. The next day, he woke up, he was fine. So he didn't really think much about it. But over several weeks and then months, every time he went outside to throw the ball and even to do shoulder workouts, his shoulder just became more and more of a problem. It was more irritated to the point that when he came in to see me, his arm could not hang by his side without it just throbbing and being very unbearable. Raising it up, he could do it, but you could just tell all over his face how uncomfortable that movement was. And forget about overhead, like anything above his head, he was like, I'm not even going to push through that. It's just too uncomfortable. But the real thing that got him was when his shoulder pain would not stop even as he was trying to sleep. So he found one position that worked, but if he rolled out of it, he'd wake up, and so that was interrupting his sleep. And as I mentioned earlier, his wife was not impressed by how short-tempered he was being with just everything. Because if you don't sleep, right, you're not in a really good mood. And if you're in a lot of pain, it's very hard to be nice. And he really didn't want to have surgery, and he didn't want to deal with any of that. He was very worried that he was going to need surgery or injections, and so he was just kind of putting this off, hoping it would heal on its own. He tried icing it, he went and got a massage, so he did do some things to try to help it, but they just didn't last, and it didn't get rid of all of his pain. And so when we met for the evaluation, he went over and started talking to me about what the problems were and a lot of the things that I just mentioned. And he's like, so is this fixable? And that was his big concern. He really wanted to know if his shoulder could be fixed and he not have this pain without having surgery. And I said, well, that's what we're here to find out. So I will tell you, once we get done with the evaluation, what I think. And so we went through. I started talking about the anatomy of the shoulder. So I was trying to explain where some of the pain may be coming from. So when you have a rotator cuff injury, so this would be the way that this faces. This is your collarbone, this is your shoulder blade, and here is your humerus. Most rotator cuff injuries affect this top muscle or top tendon up here, your supraspinatus, and that's the muscle that's responsible for your arm coming out to the side. And just like with my little model here, if I just bring this arm out, you can see how it's going to hit the top. It's going to hit that supraspinatus. And that's what happens to us, and that's what's causing the injury, because your rotator cuff would actually help pull this down and then rotate it so it would clear this space. But if your rotator cuff is not functioning, like in this model, it's not pulling, right? Then your deltoid is the only thing pulling you up, and all that does is just jam your arm bone into your acromion, which is part of your shoulder blade. And that over time causes irritation in that supraspinatus. That's the most typical version of a rotator cuff injury. And over time, what will happen is it'll actually burrow a hole down into that until it's torn. A complete tear would be where the whole thickness all the way across and all the way down is torn. But even if you have a full thickness tear, normally it's more like a buttonhole, like where you would, the hole you'd stick your button through. It's just sort of burrowed in, but you'd still have attachments on either end. And so with both of those, whether it's just irritated or even if there is a little bit that's burrowed in, with improvement of your shoulder strength, improvement of your posture, and improvement of your rotator cuff strength, there's a lot that can be done where your arm has absolutely no pain when you're done making all of those adjustments. And so that's where we started, where I educated Randall on that. And then we did the assessment, and I was able to show him where we needed to work on his posture, where we needed to work on some range of motion in his shoulder, where we needed to work on some other strengthening to help everything kind of balance out. So by the end, after collecting all of that data and moving his arm every which way, I was able to tell him that he is 100% fixable. We are going to be able to get you back to playing with your son without any problems. And I was like, the way that this process works is the first couple sessions are to help you get rid of all the pain. We need you to sleep to heal. We need you to have full range of motion without pain. And that's what we're going to be working on to begin with. Then after that, we're going to work on strengthening everything. Just making sure that you have a well-balanced strength, your shoulder, your back, everything. The final phase is what I like to call life-proofing, because nobody wants to keep having the same injury over and over and over again. And nobody wants to do rehab exercises for the rest of their life because they're boring. Let's just be honest. We want to do a regular workout and just be healthy. We don't want to have to consistently do my therapy exercises and my regular exercises for the rest of my life. And I truly believe that with being able to absorb some of the principles behind how you're supposed to move and get used to moving properly, you will life-proof your shoulder. You will know how to move in a way and strengthen in a way. It will not matter what exercise program you choose to do after you leave working with me, but you will be able to keep your shoulder healthy. And so we came up with his personalized plan for exactly how we were going to do that. And after working through that plan, he got to where he could throw a baseball with his son for 30 minutes, long enough for him to get a little bit bored without having any pain. And he has continued that now for at least the 6 months since the last time I saw him, because this was our 6-month checkup. And he is over the moon. He came in so worried that the only way to fix this was going to be through surgery or through injections forever, because that's a lot of what you find on the internet. And here he is playing baseball. He is over the moon, and now his younger son is getting into the same league, so there's lots of baseball all the time. And his wife is happy because he's not so moody. So it all's well that ends well for Randall's family, and that's wonderful. It's so nice to see people get back to that. If this is the type of care that you're looking for and you'd like to have a chat to talk about your specific situation, I'm going to leave a button below that says talk to a therapist. When you click that button, you'll be brought to a form, and it'll be asking you about what time is a good time for us to call you so that you can chat. We'll take about 20 minutes and just see what it is that you're looking to get back to and make sure that we're the right fit for you. If you are looking for things that you can do at home right now because your shoulder is just killing you and you need things you can do immediately, I have put together my best tips for how to help shoulder and neck pain. I know that seems silly, but shoulder and neck are very closely related. You really have to address both in most instances. And so I have my best tips for how to treat those in a book, and I will put a button below that says get my tips. And that will, when you click that button, you'll be brought to a form, you fill that out and check your inbox, because we're going to send you that book for free, because we want you to start feeling better as soon as possible. I hope that this information is helpful. Until we have a chance to talk, have a great day.